Be tight.
And you're proud.
I experienced the headache start, and we couldn't figure out why it was starting. I tried all different medicines. I went to neurologists and headache specialists. I was hospitalized.
That was 6 months after Morgan Lowry, then a freshman cheerleader at Rutgers, experienced whiplash, a broken nose, and a head injury. Her teammate hit her face on, falling out of a 3-level pyramid.
I didn't want to do things. I didn't want to go out. I wanted to get through my day, go through school, and go to bed.
She had a 55-week-long headache, nausea, light and noise sensitivity. Doctors were stumped. It wasn't just post-concussion syndrome. Morgan, it turned out, had a sheath of scar tissue compressing her nerves, a result of the injury. The diagnosis? Occipital neuralgia.
When there's a trauma, there's inflammation. Inflammation leads to scar tissue.
Dr. Matthew Kaufman is one of just a handful of surgeons in the country performing microvascular decompression surgery. It's an emerging technique to untangle and relieve nerves.
The compression can be from muscles that are too tight around the nerves. It can be from the tissue layers called fascia, and then sometimes even blood vessels, which are supposed to be separate from the nerve, can get wrapped around or stuck to the nerve.
It's an outpatient procedure lasting about 3 to 5 hours with minimal risk. Kaufman uses microscopic techniques to trace out the path of those nerves. To date, he's performed about 30 at his Shrewsbury office. Patients find him after medication and therapies fail.
We definitely do not operate as a first-line treatment for headache conditions. We always try the standard approaches.
By all accounts, Morgan's surgery was a success. Kaufman explains most of these procedures are prompted by head trauma from car accidents, falls, and sports injuries.
The American Academy of Pediatrics says cheerleading causes the highest rate of catastrophic injuries in high school sports, and it's just as likely to happen during practice as it is during a game.
It is dangerous, and whether it's game cheerleading or competitive cheerleading, you're doing stunts, you're tumbling, you're jumping, and these injuries can happen.
A bill in the state Senate is proposing to make cheerleading a sport in New Jersey, but even those in favor say the regulations may not prevent severe injury. Morgan has sidelined herself from the Rutgers team. She's focused on finishing her degree and coaching a JV squad at Mount Olive High School instead.
I just want everyone to be safe and be aware of the symptoms and make sure you're going to be treated if you think you have a symptom. It's not something you take lightly.
The neurology world is still skeptical of this procedure. It's only been around for 8 to 9 years. That's considered to be the infancy stage in the medical field. But both Morgan and Dr. Kaufman believe this method will take off in the next 5 to 10 years as word spreads and relief is found. For NJTV News, I'm Brianna Vanozzi.